Hello and welcome. Through this program, you'll be learning about the microbiome, or in simple terms, our gut bacteria. Pretty much all Candida diets work, but until you fix the microbiome, you're not out of the water. I thought it would be appropriate to start at the beginning, which is the mouth. And yes, your mouth has its own bacteria colony. But more than that, the chewing process is very important in the process of digestion and keeping your microbes happy. How fast or how long you chew will set the rhythm for the rest of the digestive process. Are you aware of how you chew? We'll talk about how important it is. If you chew at the proper rate, it will give the stomach time to tell the brain that food has arrived. Saliva contains a hormone called leptin. This hormone decreases appetite. Saliva also contains another hormone called ghrelin, and this one increases appetite. These hormones tell the brain when to keep eating and when to stop. But let's go a little bit further. It's not just about the stomach being full. Chewing longer actually tells the brain what kind of foods are arriving, whether it's carbohydrates, proteins, fats, or certain nutrients and things. This tells the body what type of digestion is needed. Saliva is also a source of enzymes for carbohydrates. It contains amylase, and amylase breaks down the carbohydrates to simple sugars. The more you chew, the more you mix your food with saliva, and the more saliva you have, the more amylase you have. The mouth and the small intestine have a pH of about 7. That means amylase operates in a neutral environment. So if you look at the scale on this slide, you'll see that neutral means the center of the scale. It is not acidic and it is not alkaline. The pH in the stomach is 1, so it is very acidic. This means that the amylase can't work in the stomach. It works in the mouth and the intestine, but not in the stomach acid. Saliva contains strains of bacteria, antibodies, and is antimicrobial. These all protect you from unwanted microorganisms. That means that it keeps away disease and all the bad stuff that you don't want to get into your system. It kills it before it enters the system. So a study was done on 1,000 Subway consumers, and it showed that they chewed their submarines on average each bite about 6 times. And as you're going to see, that is quite low. When amylase only has the time of 6 bites to produce itself and to mix into the food to digest it, believe me, not a whole lot of digestion happens in the mouth. According to another study at Harbin Medical University in China, people who chewed each bite 40 times as compared to 15 times ate 12% less food, and their blood tests showed lowered ghrelin levels. Remember, ghrelin is the hormone that tells you you are hungry. So in other words, the more you chew, the more your body will understand when to shut off the ghrelin signals. Chewing 35 to 40 times on average is good. Obviously, it depends on the food, how dense it is, and how big a mouthful you took. Essentially, what you want to do is chew until it's liquid. There is a saying, drink your food. Benefits of chewing. Chewing helps digestion. It increases the availability and absorption of nutrients. It decreases the risk of diarrhea, constipation, stomach discomfort, and nausea. This is a big clue that chewing has a profound effect on the GI tract and the colon. It reduces bloating and gas. Chewing your food is great for avoiding heartburn and stomach acid issues. It may aid in weight loss. Chewing longer will slow down your eating. It'll activate your leptin sooner, the I'm full hormone, and will produce more amylase to help digest the carbohydrates. The question then becomes, how much should I chew? Well, it depends on what you're eating. So make sure that when you chew, you feel the saliva in your mouth. So try this as an exercise. Something like dry toaster bread, 35 times should be about right. Something like pasta, try to make yourself chew it about 20 to 25 times. You even have to chew a smoothie. You'll think, chew a smoothie? Well, yeah, because even though the blender has chewed it for you, it doesn't provide the saliva for your actual digestion. Your pancreas will have to work hard at producing a lot of amylase to start digesting this smoothie. As you'll see, the saliva is an important part of how the gastrointestinal tract is affected. It affects how you digest and absorb. It also helps with gut function. It's all tied to the saliva, so you need to chew to release the saliva and get it mixed into your food. The only way to do that with a smoothie is to fake chew. So take a mouthful and move it around until you feel the saliva mixing in, and then you can swallow. So a little more on how to chew. Meat 35 to 40 times and fish 20 to 25 times should be pretty good. Raw crunchy vegetables 40 times, cooked vegetables 35 times, and so on. Obviously, these are approximate numbers. So, as you know, most of us are not doing this. We tend to laugh at the people that always finish last. There's usually one person in the family that does this, and my mom was like that. She always sat at the table for a good 15 to 20 minutes longer than everybody else. Little did we know, she had it right. Her digestion was complete. All right, here are a few steps to improve your chewing. Pick a time where you can be by yourself so that you can focus. Pick a specific type of food that you know you have to chew. Look at the food, take a deep breath and smell the food. Smelling and looking at the food starts your digestive system flowing. Your stomach acid gets produced along with the enzymes needed. This is easier if you're actually cooking your meal because you can actually smell it better. Start chewing one bite at a time and count. As you're counting, savor the flavor. Do this daily. Start with one food and gradually start doing it with your meals. Don't get hung up if you forget. We all do. Just do it again the next time. It takes time to develop the appropriate muscles so that it feels normal. So what happens is, say right now you chew 6 times whatever it is that you're eating. The muscles in your throat know that when you eat that specific food, you chew 6 times and then it contracts to take the food out of your mouth, even if you're trying to chew longer. So over time, you'll redevelop those muscles, and after a while, it'll feel normal to you, so it won't feel like your throat is constantly contracting to take the food down. It'll become automatic, and eventually, you'll have trouble chewing less, actually. In other words, those muscles won't contract until you're finished chewing, the way that you now have trained them. Chewing will give you many benefits, and most importantly, it'll increase your enjoyment of the food. You'll be able to taste it more. Most people eat just to get it over with, and they don't pay attention to their stomach at all. This is often how digestive issues start. Chewing well will also feed your bacteria. This brings us to the topic of the mouth microbiome. This is all about the microorganisms that reside in the mouth. And you can look at the mouth as a gateway to the body. It's complex, just like the microbiome in your gut. It plays an important role in the overall health of a person, including gut function. So you can't really talk about the gut microbiome without talking about the microbiome that's in your mouth. This isn't as well researched as the gut, but we're now starting to get more information about it. There are many studies linking oral diseases to systemic diseases. Many studies. This is important because we have to consider that the problem isn't always in the gut, but it can also be in the mouth, or both. Gum disease and other oral diseases produce low-grade inflammation throughout the body. Inflammation is the basis for most modern diseases. Most of us have this inflammation just from eating the standard American diet. The mouth is home to hundreds of species of organisms with both beneficial and pathogenic bacteria. We talk a lot about the mouth having bad bacteria, but it also has good bacteria. Either one doesn't exist without the other, so we need to focus on that. Think of the mouth as the headwater source where the river begins, and the gut as the river. The mouth sets the stage for everything in the GI tract and the body. There are over 700 species present in the mouth, but they live in different colonies located in different areas. So the tongue, the hard palate, the teeth surface, both above and below gums. No need to remember the names of these bacteria. I'll just familiarize you with some of them. So firmicute bacteria are the most abundant. There are different types of firmicutes, and you've probably heard of some of them, like Streptococcus, Veillonella, and Lactobacillus, and others. Then there are proteobacteria, bacterioses, or actinomyces, and so on. These are really hard to pronounce. Again, you have good and bad microorganisms. Some Streptococcus are bad and some are good. With the right diet, your good bacteria keep the bad bacteria from growing out of control. 45% of bacteria overlap between the bacteria in the mouth and the bacteria in the colon, so there's definitely a role being played in the gut by the mouth bacteria. We swallow 1 trillion bacteria a day. Some are killed by your stomach acid, and some have no problem making it through. Many of these seed the small intestine and the colon. So that fact alone is enough to make us understand that we have to focus on the mouth microbiome. A little warning here, this is a pretty technical slide. Listen to it a few times until you get it. So the big story, of course, here is the role of saliva. Saliva protects teeth and limits bad bacteria because it contains something called lysozyme. Lysozyme can destroy the cell's wall and stop bacteria from attaching onto the mouth's lining. This means less bacterial reproduction. Saliva also contains something called lactoferrin. Lactoferrin is a fungicidal, it's antiviral, anti-inflammatory, it helps the immune system, and this will sound technical, but it's the important part. It binds free iron needed by an unwanted bacteria called Streptococcus mutans. Streptococcus mutans is the only bacteria name you need to learn in this talk. These are not a good kind of bacteria. They cause problems in your mouth. Saliva also contains peroxidase. Peroxidase is also antimicrobial. You also find histolins in saliva. Histolin is an antimicrobial for 3 problematic organisms: Streptococcus mutans, P. genavalis, and Candida albicans. You already know about the Candida albicans, and now you've had a small introduction to the Streptococcus mutans. Something else that protects you is IgAs in saliva. This is from the immune system, and it neutralizes viruses, bacteria, and toxins. Saliva also contains a compound called agglutinins, which binds to antigens and antibodies. So again, you have immune function going on in the mouth with the saliva. Dehydration of the body by 8% diminishes saliva flow to 0. So it doesn't take much lack of water in order to start causing trouble in the mouth. This gives you another reason to drink your quota in water. Alcohol, fasting, too much exercise also lowers saliva flow, and unfortunately, women have less salivary flow than men. The skin and its protective tissues in the mouth are very porous and can be damaged easily by inflammation and infection, allowing pathogens to pass through to your bloodstream. This is how systemic diseases and immune issues begin. Bacteria and toxins are allowed to escape into the bloodstream, very similar to what goes on in the gut if you have leaky gut. You can be sure if you have candida, you have leaky gut and probably problems in the mouth also. Plaque's another issue that occurs in the mouth. A massive bacteria that grows on the surfaces within the mouth. We'll talk more about this in the future because it also happens in the gut. In the gut, it's called digestive plaque. In the mouth, it starts as a sticky, colorless deposit. It becomes brown or pale yellow. Then, of course, you already know about tartar. The hygienist at your dentist's office scrapes it off your teeth. This is also known as microbial plaque or oral biofilm. The bacteria that are mixed in there are what form the biofilm. They do this as a form of protection against antimicrobials. This is something that happens in the gut also. For example, Candida albicans can build a protective coating around itself. It then becomes a form of superbug because once they do this, you can't destroy them. Don't despair though, because there is a way. We always discuss how intestinal dysbiosis is linked to so many health conditions. How can we not consider dysbiosis of the mouth in the same light? It can be just as damaging as the gut dysbiosis. The pathogenic bacteria is hardened into plaque, making it far harder to remove. As you know, you can't even scrape it off without going to your dentist. It isn't as easy to remove as intestinal plaque, but don't kid yourself though. Intestinal plaque isn't so easy to remove either. Periodontitis, a severe gum infection that can lead to tooth loss and other serious health complications. It refers to the inflammation of the tissue surrounding the teeth. It causes receding gums and the loosening of teeth. Now, I'm very lucky because in my family, this runs in my family. My sisters are losing some of their teeth because of this. I have not had that problem yet. And it's considered a factor in systemic disease. There are 3 pathways where the mouth infections affect other systems, and we're going to go through them now. So number 1, spread of infection from the oral cavity as a result of transient bacteria moving into the blood. Transient means these bacteria are not attached and are free-flowing. This happens through your damaged teeth. Number 2, here's a mouthful, injury from the effects of circulating oral microbial toxins that spread to other systems. So all pathogenic bacteria, yeast, fungus, or anything like that produce toxins that can enter the bloodstream and cause symptoms. We'll be talking more about that later as well. As you may already know, Candida releases toxins that make you crave the wrong foods. These are the type of toxins that also create havoc in the body. Number 3, spread of inflammation caused by oral microorganisms. So these little bugs can set off inflammation in other places around the body. And of course, inflammation is the beginning of most diseases. The factors in mouth dysbiosis are very similar to those found in the gut. They both have similar links to the same inflammatory products, endotoxins, and systemic diseases. So this makes it an important focus for reversing health issues. The microbiome is very complicated, but the more we understand how it affects our health, the better chance we have at a long, healthy life. Bacteria linked to tooth decay and gum disease can enter the circulatory system, linking this to heart disease. This causes the liver to release something called C-reactive proteins, which have inflammatory effects in the entire circulatory system. C-reactive protein has been known to increase due to bacteria, particularly Streptococcus A, and is linked to many conditions, including autoimmunity. Many professionals have known about the link between tooth decay and heart disease for some time now. We also know that C-reactive protein is a marker for heart disease, so you can start to see the relationship that could indicate why the mouth bacteria is partially linked to heart disease. Allergies. Airborne allergies lower saliva and can cause dry mouth, increased cavities, plaques, and so on. Antihistamines lower saliva production even more. There are other drugs as well that can lower saliva production. We'll talk more about immunity throughout the course, as it's important to understand it for why you have allergies and autoimmunity. But understanding that there is a component of this in the mouth is important. Oral tolerance means that you can tolerate things without having any allergic reactions. It's very similar to immune tolerance in the gut, as you will be learning throughout the course. Other health conditions that may arise from mouth dysbiosis are things like migraines, pneumonia, diabetes type 2, autoimmunity, cancer, arthritis, osteoporosis, nervous and brain conditions. These are all conditions linked to inflammation and chronic inflammation, and therefore something that can be affected by the mouth, your oral biome, the same way the gut microbiome can affect these conditions as well. Hormonal issues. Both high estrogen and progesterone increase plaque and gingivitis buildup, especially during pregnancy. Birth control, even low doses, has been linked to gingivitis. And menopause, a decrease in estrogen and progesterone causes dry mouth, chronic mouth ulcers, jaw shrinkage, and osteoporosis in the jaw. So we need to correct the balance. If you're pregnant, on birth control, or you're menopausal, I'll give you some strategies in a minute, and you can apply them to help with your oral microbiome. Things that lower good bacteria. So smoking is the first one. A study of 1,204 people, smokers and non-smokers, found that smokers' mouth bacteria was substantially different than non-smokers. The good news is that there was no difference between former smokers and people who never smoked. That means that you can reestablish the good bacteria in the mouth if you quit smoking. Smoking increased 150 strains of bacteria of the Streptococcus variety and lowered 70 strains that break down toxins. Smoking decreases oxygen, which increases acidity, which supports the wrong kind of bacteria of the Streptococcus and Lactobacillus variety. Most importantly, smoking interferes with saliva production, your protective mechanism. The second one is alcohol. Chronic drinking causes plaque buildup and tooth loss. You can see this in the severe alcoholic. It kills the good bacteria. It doesn't cause much damage to the moderate drinker. Red wine is actually beneficial because it can inhibit pathogenic streptococcus. How often have you thought your teeth could be an issue for your health? Chances are you haven't really thought about it. What do you use as a mouthwash? Listerine and Scope with antibacterial properties can make a lot of damage. Most nutritionists focus on the gut, and maybe the focus should start with the mouth. Many of your symptoms may have started there. How many people continue to have issues because of their mouth microbiome? Consider these symptoms: headaches, gas and bloating, muscle and joint pain, which is chronic inflammation, constipation, diarrhea, skin issues, and brain fog. These are all symptoms we consider with gut dysbiosis, so keep this in mind. If it can come from the gut, it can also come from the mouth. In terms of probiotics, what do we know with regards to how helpful they might be to the mouth microbiome? As I mentioned earlier, the bacteria that causes the most problems in the mouth is Streptococcus mutans. Research is looking at probiotics that may counter this particular strain of pathogenic bacteria. Streptococcus salivarius has been studied quite a bit, and there's two strains that have been studied, K12 and M18. When you look at probiotics on the bottle, you'll see that there are numbers after the name, and that refers to the strains that they've put in. So there's many Streptococcus salivarius strains, and these are the two that they've studied. What they found is that they both lowered plaque and inhibit Streptococcus mutans, which causes less cavities and less halitosis, which is bad breath. The same diet that is good for the gut is also good for the mouth microbiome. So remember that a huge part of feeding your gut bacteria is chewing your prebiotic foods well. If you remember, the prebiotic foods are what feed the probiotics. We'll talk a lot about that as we go along. How much you chew really determines not only the mouth microbiome, but it also sets the stage for the entire gastrointestinal tract. Sleep is also important, preferably with your mouth closed. Many of us sleep with our mouth open, which causes dry mouth. Saliva is highest in the afternoon and lowest at night. Lower your stress level. Throughout the program, we'll keep talking about stress. Stress lowers good bacteria and increases dysbiosis. This is true for the mouth and also for the gut. Dysbiosis increases cortisol level, your chronic stress hormone, so you don't want that. Lowering your stress level will have a positive effect on your oral health. Chew your foods thoroughly. The chewing motion stimulates saliva function. Remember, this is why you chew your smoothie. Even sugar isn't as damaging when it's mixed well with the saliva. So again, it's all about the saliva. Stay hydrated, and no need to over-exercise unless, of course, sports is how you make a living. Working out too much can be a stress on the body. Moderate exercise is a healthier, long-term practice. Of course, don't smoke, don't drink too much alcohol, and don't use alcohol-based mouthwashes. Those are the very worst. So what can you do? You can use essential oils, peppermint, cloves, cinnamon, and so on. You can find these in essential oil toothpastes. You can also find blends that will combine a lot of these. Here are two that are on the market. One is called Body Food Dental, and doTERRA also has one called On Guard. doTERRA is a multi-level company, so you can decide whether you wish to support them or not. You can also mix your own essential oils, but make sure they are of food grade. So you're looking at the more expensive organic brands to be safe. These kill bad bacteria, but not the good. Another thing that you can do is oil pulling. I've only heard of coconut oil being used for this. Put up to a tablespoon in your mouth as soon as you wake up in the morning. Swish it around for 20 minutes. You can have your shower as you do this. When the 20 minutes are over, spit it out and brush your teeth. Coconut oil is antifungal and antimicrobial. It contains caprylic acid and boric acid. If you do this every day for 2 weeks, you will notice a difference. Over time, it'll help break down the plaque, especially if you have a good brushing routine. You can also buy probiotics for your mouth. There's one by AOR called Breath Biotics. I've put it on the slide here. There are lozenges that they have a wintergreen flavor. This gives you a lot of the Streptococcus salivarius. You can also buy Culture Care probiotic gum, which has Streptococcus salivarius as well. Professional teeth cleaning is also very important. Get your teeth cleaned. They can remove most of the plaque very easily. So to finish off, start looking at the role of the mouth differently. This is an element that you'll want to add to your new healthy living protocol. You may be surprised how much changing your oral habits make you feel better. So ask yourself these questions. Do you chew enough? Do you sleep with your mouth opened? Do you often have dry mouth? Do you drink your water quota? If you exercise a lot, do you replenish your water? And how are your brushing habits? I hope this PowerPoint helps you understand how complex our microbiome is and how important it is to look after it well. This isn't something you'll learn from your doctor, as they haven't been trained in any of this. They have amazing specialties, but the microbiome isn't one of them. Even most natural healthcare providers won't be thinking of the microbiome in the mouth. In school, we learn the basics. Then we decide where to specialize. I chose weight loss and gut healing. I feel those two are important because once you know how to eat for your body and understand gut bacteria, there aren't too many health issues that can break through. So you have now begun this journey into the microbiome. Enjoy the ride.